Hello and welcome to Join Our Town. I'm your host, Tammy Jo Johnson. Join Our Town brings you the issues and problems that are faced in the local community with the hope of finding a solution. Our guest for this segment is Vicky Ghiloni, health nurse for the At-Risk Pregnancy Program, and Sue Jacks, public health nurse for the Breast Cancer and Cervical Cancer Program at the Licking County Health Department. They join us today to share important information regarding at-risk pregnancy counseling, along with contributing factors that may put a pregnancy at risk. Thank you so much for joining us today.
Thank you.
So let's start with you.
Yes.
Tell us a little bit about yourself and your position. You're a nurse,
Yes.
a registered nurse.
Yes.
Tell us about what it is that you do, because we know that nurses do a lot of things.
Yes, nurses wear many hats
Yes, they do.
nowadays. At the Licking County Health Department, my main job is the At-Risk Pregnancy Program. I work hand in hand with the WIC program, and anyone that is pregnant or even has a newborn, I see that mother. Children are on the WIC program up until the age of 5, but I only see them throughout their pregnancy and then one time after delivery.
Okay, thank you. And how about you?
Well, I'm currently the case manager for the Ohio Breast and Cervical Cancer Project. It's a federal grant that we got at the Licking County Health Department in 2009, and it is part of the National Breast and Cervical Cancer Early Detection Program, which means that it's in all 50 states. And so I take care of the region here in Central Ohio for the program at the health department.
Awesome, thank you. Now, Licking County has an at-risk program, and I know for me, I'm a mom, and I had an at-risk pregnancy with one of my kids, but tell us what at-risk means, because a lot of people don't know.
With the health department, especially the WIC program, as I said, anyone that is pregnant is enrolled in our program because of the nutrition risk.
Okay.
We do have registered dietitians on staff. They counsel the mother through their nutrition, give suggestions, and they also are given food options. And we do have the cards nowadays where they are uploaded. They're like a little credit card, and the mothers go to the grocery store and choose from a selection of what they want.
So in terms of that, everyone that's pregnant, it doesn't matter like what their income is, it doesn't matter whether if they work?
Actually, yes, it does.
Okay.
It goes along with financial guidelines. If you are eligible for the WIC program, then you are automatically enrolled in my program also.
Okay, so at risk and high risk are two different things.
Yes,
Got it.
they
Okay.
are.
Okay. So what's the motivation behind that program? You said lack of nutrition. What do you mean?
Yes, a lot of our mothers are low income, and the lower income, have limited resources. So of course they have to pick and choose when they go to the grocery versus good food versus cheaper food. Like a lot of them may eat pastas, which is not bad, but if you eat that a lot and you don't get your 4 major food groups, then that can affect your pregnancy.
So in your professional opinion, how would you describe a healthy pregnancy?
A healthy pregnancy is a mother who presents with really no foreseeable problems. A lot of times the moms are healthy. Many of them are, of course, quite young, but there are a few that have underlying health problems such as diabetes. They've had surgeries of some sort, and we do get them connected with other services. They also will come to Columbus and meet with a high-risk doctor over here.
Okay, and that makes a lot of sense. I know a lot of agencies are doing that. They're trying to be like a one-stop shop, you know. Now tell us a little bit about WIC, the Women, Infant, Children Program. Tell us about that a little bit.
I work hand in hand with the WIC program. Any woman that presents to WIC who is pregnant or has just had a newborn, I do see that person.
So because I know that a lot of programs like yours are trying to be like a one-stop shop where you have all the services involved in one.
Yes.
But isn't WIC limited to what you can buy?
Yes, they do have a food package that they will hand out to the client. And it depends upon how many children they have. If there is a breastfeeding mother, they get a different packet versus a formula feeding mother.
Does that play a part in why the nutrition is off a little bit, or are you saying that there are supplements, you know, in addition to that?
No, with a mother that comes to WIC and is eligible for WIC does not have a lot of times the financial resources to buy the healthier foods versus the cheaper foods. When you're choosing between, you know, paying your bills versus buying healthier things, then of course the cheaper food items come into play. Plus the WIC registered dietitians also go over with the parents and educate them about healthy eating.
Okay, so they do provide education, because I know a lot of
Yes.
times it's not that they don't want to choose the healthier option, they just don't know what it is.
Yes, yes, they
And
meet with
so
them.
so then when you say health, so the lack of nutrition is what caused problems with the pregnancy?
Yes, it can definitely.
Okay, that makes sense. So you're a nurse as well. Do you have any experience with just pregnant mothers, period? They may not be, you know, high risk or whatever, but they lack nutrition in some areas.
Well, again, I don't work in that program now. There was a time when I was one of the nurses, as Vicki said, wore a few different hats, and I actually got to do a little bit of the at-risk. And I think, like Vicki was saying, especially the younger mothers, they've got a whole lot of things going on that's taking priority sometimes, and the low income and just lack of education and knowing what to do.
Right.
I think the dietitians do a great job providing that education, and then the WIC program can supply them with the resource to make better choices.
Make better. Yeah, and that makes a lot of sense. You know, along with being at risk, what are some of the pre-existing issues that they may or may not have had, you know, before, like before they even were diagnosed with being in a high-risk pregnancy? What are some of the issues that maybe they came into the pregnancy with?
They can come in being a diabetic. They can come in being a smoker. They can come in with other health issues that are going on. Some women have had major surgeries, and some women just need to have the education, because a lot of times they don't realize that smoking is detrimental to the pregnancy.
Right. So does your program cater to those women as well?
We do have a health educator also up to the health department who covers our smoking program. It's called Baby and Me Smoke Free, and where she meets with the client every time they come in for their WIC appointment, and she will go over coping mechanisms, give them ideas on how they can decrease or quit their smoking.
Wow. And you also work with teen moms.
Yes.
Tell us a little bit about that. We don't hear too much about that anymore, not the positive anymore.
Teen moms can sometimes be a little more challenging. They're, you know, teenagers sometimes think they know it all.
They do.
And sometimes it is a little more challenging to get them to realize you need to eat healthier, you need to quit your smoking, and you need to follow your doctor's advice.
Do you find that it's harder to get them to breastfeed?
Surprisingly, they are more acceptable sometimes than the older women are.
Really? Why do you think that is?
Yes. I think because it is so acceptable nowadays, a lot of women are wanting to try to breastfeed. And the teenagers, I think, are more laid back and not quite as uptight when it comes to the newborn and what is normal. Whereas some of the older mothers expect a lot more.
Right, and that makes a lot of sense.
Yes.
So, you know, with the audience that we have watching today, if they are pregnant and they're having issues, especially, you know, in Licking County,
Yes.
how would they know to link up with you? Like, when they find out they're pregnant, if they're younger, it's a panic. So how do
Right.
you reach out to them
Right.
once they find
Right.
out?
The WIC program is pretty well known in Licking County. They have quite a large clientele. And of course, word of mouth can get around, and we do have in the doctor's offices, they know about the WIC program and can direct the pregnant woman to our services also.
Wow, and do you offer any other programs within that program for young mothers or mothers that are at high risk?
We do offer the breastfeeding.
Okay.
I am a certified lactation consultant, and we also have a breastfeeding peer.
Nice.
I teach a class up at the health department, which is free of charge, every other month. And Robin Hoops, who's our breastfeeding peer, she is in closer contact with the moms because that's what she does, versus I, do wear different hats.
Wow, that's a class to teach.
Yes, it is. It is. It can be quite humorous sometimes. And the mothers are really receptive to the class. And we do go over quite a bit of information, demonstration on how to correctly position and latch a baby on. And we watch a video.
Wow.
So it's about an hour and a half at least.
Awesome. That's amazing. That's awesome. So, with some teens or young mothers that may be watching the show today, what advice would you give them if they're really not getting the food that they need, or they're unsure of what that means and they're still gulping energy drinks and things like that?
Get in contact with the WIC office. If they are eligible, then we can get them scheduled and come in and talk to a dietitian who can direct her to the healthier food choices. They also, when they go through the clinic, they weigh them every time they come in. They test their iron levels, make sure that they're up to where they need to be. And if there are any problems with that, then we can get a hold of their OB doctor.
Awesome. And do you have a phone number or website?
We do have a website, Licking County Health Department,
Okay.
and you can get on there, and we have a list of things that you can go through, or you can call our direct number.
Okay. Thank you so much for being here with us today. We really appreciate the information.
You're welcome.
You're welcome. Coming up next on Joy in Our Town, breast and cervical cancer awareness. Stay with us. We'll be right back.